Prostate cancer is the most common cancer in men in the United Kingdom, with more than 70 men being diagnosed with the disease every day. Prostate cancer is most common in older men, probably in the 50 plus age bracket, but the risk increases with age.
I've lived here since 1962. Basically, I came here to find work. When I found work, it was a local chemical plant, and I stayed there for 30 odd years. My hobbies: fishing, sailing, and a little bit of football, but not very much. And basically, that's, the way I've lived.
The signs and symptoms that we ask people to look out for are going to the toilet to pass water more frequently than normal, particularly at night time if you're getting up several times during the night. Also, if you're having problems in emptying your bladder, or the flow of the urine is interrupted so that you're experiencing dribbling and not got a constant stream of urine, then you need to be getting yourself checked out.
Well, basically, I was diagnosed as diabetic quite a few years ago. Later on in life, what happened was I was going to the toilet 3 and 4 times a night, which, well, I thought there's something quite wrong here, for I dismissed it for quite a long time for the simple reason I thought, being a diabetic, you do go to the toilet more. And then I suddenly realised to myself, well, it's not on, there's something wrong, and I went to the doctors. From the doctors, I was sent to the hospital, and they did a few tests, but prior to that, they do a blood test when you're a diabetic every 6 months, and protein showed in my urine and my blood, so they knew there was something wrong, but not quite sure what, until I got to the hospital. I had a scan, and I found out that I got prostate cancer, which I wasn't too chuffed about. I was a bit worried, but then again, the doctor said to me, well, if we've caught it early, you're all right. We'll deal with it with tablets. Unfortunately, it finished up with an operation, which went quite well. They had to remove the prostate altogether. It took quite a while to get over it.
With the early presentation of cancer symptoms programme, what we're encouraging people to do is to go and seek help early, because we do know that people presenting early with disease are much more likely to get a good treatment outcome. So if people recognise any of these signs and symptoms that Alan has described, it's important to make an appointment and go and see your doctor as soon as possible. They will take you through a history and ask you some questions about what you've been experiencing. They may arrange for a simple blood test for you, but if they think there's any problems, they'll be referring you on to the hospital to see a consultant who will do further tests.
I wish I'd have gone a lot sooner, to be quite honest. All I've got to say is, if you've got any symptoms, going to the toilet, having difficulty, your bladder not feeling empty when you've been, go to your doctor.
The specialist team at the hospital have lots of important information that they can give you, booklets about prostate cancer, what's involved with diagnosing it and what's involved with the treatment options that you may have, because everybody's an individual, and depending on what stage you go along and see them, you will get different treatment options presented to you.
It's nearly 2 years since I had my operation. I feel fine now. There's nothing I can't really do. It's just basically life as normal.